So what I try to do when I do an evaluation for a patient is I try to tell you the story of your mouth. I want you to think of it as a book with a theme and 4 chapters.
Okay.
The theme for you, great genetics. You've really got great genetics. You had a nice orthodontic result. The problem with a patient like that is they tend to rest on their laurels. So you're invincible because of your good genes. And while that's true, there's a few things that are catching up with you. So if we think of an exam as a book with a theme and 4 chapters, the chapters of the book are teeth, bite, gums, cosmetics. And we look at it must do, should do, could do. Okay? Let's start with the source of your main complaint, which was tooth sensitivity. There are 2 kinds of teeth in your mouth, front teeth and back teeth. Back teeth keep your chin from hitting your nose, or the stops. The front teeth are supposed to be overlapped in such a way that they lift and separate the back teeth in a side-to-side motion. Your orthodontic result left your front teeth apart and not coupled together. As a result, the back teeth rub and grind and slide across each other. Now those back teeth are built like a Dairy Queen ice cream cone dipped in chocolate. You've got a hard shell layer, but if you took that ice cream cone and you moved it back and forth, it would tend to crack or bend right where it joins the cone. You don't think about your tooth bending, but if I was going to break your arm, it bends before it breaks, and teeth likewise are flexible. So this is the cause of your sensitivity. What do we do about it? Well, you haven't done a lot of damage to your teeth. It would be nice to think about a bite orthotic that would artificially create some coupling if it gets bad.
Okay.
Must do, should do, could do? Definitely not must do. Should do, could do? Yeah. This is a bite orthotic. It's called a spear splint. It sits on your lower front teeth, and lo and behold, those front teeth are gathered together and coupled together. So that's the key, okay? If you notice more sensitivity when you wake up in the morning, then you're definitely grinding at night. If it's just a general problem, no big deal, okay? So think about that.
Okay.
Chapter 2, cosmetics. You're beautiful. Your teeth are beautiful. They're white. You do have some bonding on the back that's a little thick. We might polish that down a little bit, but there's no issues cosmetically for you. Teeth. Well, again, with the sensitivity, we look for cavities, and there's 2 kinds of cavities that can happen in one's mouth. Cavities in between the teeth, don't have those, and cavities in the grooves of the teeth. And there's some of that. Teeth develop from lobes. The lobes fuse to form cusps and grooves. And if they don't coalesce well, you get a little chasm down in the groove of the tooth. And you can see that when we start looking at some of these pictures. You see the little dots here, maybe another picture, Tara, right here. You see the groove that's dark. So these are things that might be sealed if you're a child, but technically they're cavities as an adult, so we do a small filling. Hopefully they don't have to get real deep in them, but you've got 4 or 5 teeth that are like that. Is it causing the sensitivity? Maybe. I think probably more so the bite is causing the sensitivity, okay? The other thing that can cause the sensitivity is your wisdom teeth, and you're 17, and it's about time for those wisdom teeth to show their little heads. And as you can see here on the x-rays, they're trying to develop. There's 2 things about wisdom teeth. Do you have enough bone for your wisdom teeth to come in? Everybody asks, do I have enough bone? Well, maybe. The question they don't ask is, do I have enough gum tissue surrounding and investing that tooth? There's 2 kinds of gum tissue in your mouth, cheek tissue, gum tissue. Pretty sketchy on having enough gum tissue that's proper to surround and invest that tooth, okay? So probably need to get those out. They're about 2/3 root development. Now's the time to do it. As they continue to grow, they're going to hook around. They're not going to grow through that nerve that we see here, so it's probably time to think about wisdom tooth removal. That's usually done with a sedation here in the office. If you're going back east to school, we may need to see an oral surgeon, but it's time, okay? The last, and arguably the most important thing to talk about, is gum health. And the way I present this is I ask if the patient has a dog.
No.
Have you ever had a dog?
When I was little.
What was your dog's name?
Jazzy.
Jazzy? What kind of dog was Jazzy?
She was a Havanese.
Havanese. I never heard of a Havanese.
They're really cute. They're like this big and they're like white and fluffy.
Okay.
So,
So Havanese had a water bowl.
yes.
And if you didn't clean it all the time, it got slimy.
Yeah.
And that's what I want you to visualize as growing on your teeth every day is Jazzy's dog bowl film. And you've got to get it off. And it's not that easy to get off, okay? I like to start that process with electric toothbrush. I like the Oral-B the best.
Okay.
I like the ones with the little yellow bristles here. You can go to Costco and get a 10-pack of heads for 40 bucks. You change them every month, okay? You punch it. They run in 30-second increments, interrupting every 30 seconds for a total of 2 minutes of toothbrushing. So 30 seconds outside, inside, inside, or 30 seconds a corner, whatever you want to do. 2 minutes twice a day. Think of your tooth as a castle. You're cleaning the north, south, and top of the castle. What do castles have around them in medieval Europe? A ditch with a water in it. It's called
oh my God.
a moat.
Yeah, I couldn't think of it.
Okay,
Yeah.
I know. Pressure. So we were measuring your moat space a minute ago, and we want it to be 1, 2, or 3 millimeters and not bleed.
Okay.
And you had a lot of 2s and 3s and 1s. You had a couple 4s, and you had some bleeding.
Okay.
So you need to clean that moat space with a moat brush. Here, Tara.
I have one, but it's like a wider, like.
Yeah, well, we're going to go over that right
Yeah.
now.
Okay.
So as we look, give her a mirror, please.
Sure. Here you go. Do you mind to hold this? Thank you.
Moat brush.
Right here.
So this is a moat brush, okay? It's designed to be used at a 45-degree angle to the junction of the tooth and gum. And the way that that looks and feels, we're going to see how it blanches that gum tissue. Or let's do it up here. See how it blanches that gum tissue white when we slide it up underneath the gum line. Okay? And that's not bad. That's not bleeding too much there. I suspect if we went up here a little bit, we might get a little bit more bleeding. Got a little bit of bleeding there, not much. If you bleed, it's because Jazzy's dog bowl film on the side of that castle has produced enzymes that have dissolved the skin lining next to the tooth. So if I pull that gum back and look, I'd find a little ulcer on the inside of that gum lining.
Okay.
And that's what you've got to heal. You've got to get skin on the inside of that gum lining. You can't have an ulcer, okay? So we've cleaned the north and south ends of the castle. On the east and west ends, we're going to floss. And when we floss, we're going to shine shoes, flip the gum back and forth. We want to see if you've got bleeding or no bleeding. And for the most part, you're not really bleeding too much, just a little bit, okay? So, good. So I'm going to give you like an 80, 88 on your grade today.
That's a good start.
Now, we've taken Jazzy's dog bowl film and we've loosened the film and we have a big scummy mess floating in the bowl. Let's see if you get the next question right. What's the next thing you do with the bowl? You got a big scummy mess floating in the bowl. What do you do?
Throw it out.
You
Throw
rinse
the
it out.
water, yeah.
Okay, good. So you have to rinse it out. So, Terry,
Yes.
we use a water pick. I like the water pick brand. You're going to fill it up with water. You're going to stick it in your mouth first, turn it on, and you're going to trace the neck of this thing over the sink around the neck of your tooth. Can I have a cotton plier, please, Terry?
Sure. Of course.
Here you go, Terry. And the way that that looks and feels, you're just going to go around the neck of the tooth, inside and out, over the sink, and you'll be surprised what comes out of there. That is a key to good dental hygiene long term. And if you'll do that, you'll have excellent dental care. The buildup that you see on the backs of your teeth right here, if that film is on there for more than 24 hours, the calcium in your saliva plates out and makes that hard deposit called calculus. So that is the key. And like I said, genetically superior. You're a high B student. I know you could do A work. So
I got you.
let's work on that.
Okay.
Small, minuscule cavities, wisdom teeth, it's time. That's about it. All right? Any questions?
Mm-mm.
Okay,
Sounds
good.